It's the Becky and Boca Show, coming to you live every Thursday night at 6 p.m. from glamorous downtown Boca Raton. I'll show you how to live life in style in one of the country's most elegant cities, nestled right along the beautiful Atlantic beaches between Palm Beach and Miami. So sit back, relax, and let me show you how to indulge yourself Boca style. I'm here with
Thank you.
Dr. Art Handel, and this is my big unveiling. He did my whole face, and it was only 2 weeks ago, so I'm still very swollen, but I'm very happy to be back, and everything was wonderful. And we're going to go through step by step and explain exactly what I did. So you want to start?
Well, first of all, I want to say that it was a pleasure working with you, and it was an easy job because you're a beautiful woman. You always have been.
Well, thank you.
And so it was. I had good base to work with, but nevertheless, I mean, you had
I had a lot of issues, and we can show the pictures when we're ready for our befores.
You carried everything well, but you're at the early stages of some issues.
No ages.
No. And you had a little bit of, starting from the top to the bottom, you had a little bit of sagging of the brow, nothing extreme, but it just gives you a little bit of a tired look. And
can you come forward a little?
You had a little bit of an issue with the neck where the muscles.
A little bit. That was my main thing. I had all this stuff hanging down under my neck. I was always trying to disguise, and I tried a couple of procedures, non-invasive procedures, with minimal results. Got me a few more months, maybe.
A little bit, yeah.
But eventually, I realized that there was just nothing I could do short of surgery to.
See, it happens. What happens is that the anatomy. You have to understand the anatomy because what happens with aging of the face is that you lose volume. That's number one. That's why fillers are so great in the early stages.
Yeah.
And
fillers can keep people going for quite a while.
Oh, they're great. And, I try to be honest with my patients. When I see them, if I think they need more than 3 or 4 syringes of a filler, then they really should start considering some type of a surgical procedure or even just fat grafting because of the amount of volume that we can use. But nevertheless, we have, you have to assess the issues, and then it's not just, so it's a loss of volume, and then the tissue starts sagging mostly because of a combination of loss of volume, and then the muscles start to relax.
The muscles. That's the key. I was trying things that were going to tighten my skin, supposedly, but I guess there's nothing you can do short of surgery to
those machines,
tighten muscles.
Too bad they don't work
I tried radio
long-term.
frequency.
Right.
And all therapy.
They work to a minimal degree short term, and the problem is you have to keep repeating them. They're expensive, and there's a place for everything. So it's nice if you can do it on certain patients, but for a long-term result, and then you also have to keep in mind the cost of these procedures. You want to try and give the patient the best result possible. So the most long-term result is from a facelift. And the other factor is that you're tightening the muscles, you're putting everything back where they belong. That's part of the problem. It's almost like a 2-layered facelift, and then you pull back the skin. So that's what really gives it the longer lasting results. And then when you add volume, that's the icing on the cake. And we discussed this in our pre-op. We saw your pictures when you were younger.
Yeah,
you had your cheerleader's outfit.
My younger pictures, but I'm going to ask Freddie to put up my before pictures here.
It's not so flattering. You look much better than that.
I chose that picture, actually. You didn't, so
but
I'll take credit
you could
for
see
it.
from that picture, you have some laxity. You still had a little bit of a tired look. You've lost some of the arch to your brow. The nose looks a little wider at the top because of the brow skin that's getting heavier in that area. And you could see it's not just sagging, it's loss of volume.
Turkey neck.
That's the nemesis. That's the first
problem. That's what most
problem.
women complain about. Every woman I know that wants to do something, it usually starts with the neck.
They come in complaining of the neck, and the problem with that is it's twofold because, of course, part of it is genetic and part of it is sun exposure, but the biggest factor is weight fluctuation. And most women, after the childbearing years, their body has gone through several.
Okay, Freddie, you can take that off.
Several weight loss, weight gain and weight loss cycles, and that stretches things out. That causes a lot of that sagging problem. And a lot of women come to me, or a lot of men come to me, they say, listen, I just want to get rid of that neck. And it's very rare that you can do that effectively
Yeah,
because
see,
you have
that's
the
the
jowls
problem.
along with
People
it.
tell me, I just want my neck done. But I have a totally different belief. I think you should go to a doctor and say, what do I need done? Not tell the doctor what you think should be done. Because like you said, it's all connected. So
Correct.
you can't really fix the neck without fixing.
And that's one of the problems with this type of surgery, because there are so many different incisions that have been devised as far as mini lifts and S lifts and this lift and that. They give a lot of names to it.
The
But,
lifestyle lift, what was that?
well, that was basically, from what I understand, the minimal skin elevation and minimal muscle tightening from the very most lateral portions of the muscle that was done under local anesthesia. A lot of the people who were performing those operations weren't even plastic surgeons.
Oh, my goodness.
So there was a problem. They're not in business anymore.
Yeah, I know
But,
that.
a lot of those procedures sound attractive because people think that minimal surgery is
Yeah.
always the best.
To make it sound like it's quick and easy, I think. But what I learned with you, I did a lot of procedures, and it was, you're back up very quickly. The only thing that slowed me down was that I did laser.
Correct.
But you could do a whole facelift and within, a few days be back out and around. It's not.
We've had patients that even the next day, they can go out in public with almost no bruising or very minimal
Right.
bruising. That varies from person to person because some people are just more oozers or bleeders, but for the most part, most women have less bleeding issues than males do.
Oh.
So you can do this quite effectively with almost no bruising or very little bruising, and the more procedures you do, something causes a little extra bruising, but within a week they look pretty
Yeah,
good.
I was surprised. The downtime
Yeah.
really was not bad. But before we go any further, let's go step by step what you did
Okay.
on my face. So we want to start with the neck?
Well, we assessed you. We looked at your photographs when you were younger, and then I showed you what my plan was to get you back to. It's just a restoration operation, and one of my hobbies is, like I said, restoring classic
we're
cars.
restoring a car.
And major emphasis is made on originality. So that's one. If you're like that on an automobile, I mean, that should be what it goes without saying.
Oh, I love that when you said bring me in a picture of when when you're young. So I went back and I got like the 2019, 23. I gave you one when I was in my 30s, but
yeah, that that should goes without saying. For a human being, you have to go back to the original, and that's why facelifts look unnatural in many.
when they try to change things, right?
When you try to change things, or basically if you're put back together the wrong way, it's not how tight you make it; it's how it's put back together. And there's certain landmarks that you have to respect, the hairline and everything, and there are certain ways you could do the incisions that are virtually invisible.
You were explaining that on the video that I put on Facebook. The big fear that all women have when they go to get their face done is they tell the doctor, I don't want to look pulled. But you said that's just where they position the...
That has to do with the positioning because, like I explained to you, when we do a facelift, you have to make it as tight as you can.
I would say you want it tight.
You don't want it too tight, you don't want it too loose. If you make it too tight, the skin actually necroses. The skin dies at the wound edges and you get bad scarring and you get healing issues. So it's a fallacy thinking that you can over-pull a facelift. You can't make it too tight. The reason why they look too tight is because they were pulled in the wrong direction. So if you pull the eyes back the wrong way and the sideburn goes back here, you have a very distorted look. And usually you see it around this area. Mm-hmm. That's the giveaway. Or you see it around the ears. Or in a patient when they flex their neck in this position, you see the lines going up this way, especially if they have wrinkled skin. So those are the things that you look at. But the neck was an issue, and you had pretty much
Was it ever?
very
That was-
little fat at all there. So after we did
Yeah, I had a couple of procedures to get rid of the fat under my neck. And then what happens is you just have the saggy skin.
and everything was exposed, your thyroid,
Yeah, you can
cartilage,
see.
because you're a thin person, you're a thin woman to begin with, so you didn't have that much to be. We try to preserve. I rarely take out fat during a facelift. I only take it out in certain areas where it's abundant.
Mm-hmm.
Usually if they have a heavy neck, there's a little wad of fat underneath the muscle that needs to come out surgically. And then we bring the muscles together with permanent stitches. So it's almost like a corset of the neck muscles. And then after we lift up the skin on the cheek, then we lift up the face muscles, the cheek muscles, and put them back on top of the cheekbone. and it gets rid of the jowls and it restores your cheekbone the way it was during youth. When you look at a 3/4 view of your face, your cheek should come out like a little bit like an apple and then go in. And you'll see a lot of patients with aging of the face, this area is flattened.
It's flattened, right?
And then, so once we did that, then we started off with the endoscopic brow lift. And the way we did that,
Oh, that's what you did first?
that's what we did first.
Okay.
And then
That's a great procedure, by the way.
I love it.
Now you can do that as a standalone procedure, right? If someone
If that's
just
if
needs
that's
that?
all you need, that's all you need. When I approach eyes, when I first look at a patient, the first thing I look at is your eyes, because to me the eyes are the most important part of your face. They give you your expression, your natural look, your appearance of tiredness, sadness, happiness, anger, and the brow is very important. So a lot of people who have, for instance, hooded lids, like myself, you show that at an early age. More than someone who has deep set eyes, they don't have that much skin on top of their lids. So
Okay.
what the problem is when the brow descends even a few millimeters, it shows. And that's why a lot of patients will have some skin removed initially. But to me, that's not really the best way of doing things because your brow will still be low.
Still
And
low.
it'll actually appear even lower because you have less skin
Right.
between your eye, lid, and the brow. And then the brow should have a little bit of an arch. So what we did was we just restored it, and then you get a little bit of a heaviness. Patients tend to get a little heaviness here, and the nose actually looks different. And a lot of patients say, "How come my nose looks different when I get older?" It's because the brow is falling down, just give you a little bit of a different look up at this part of the nose. So what we do is we made 3 tiny incisions behind the hairline, taking care not to damage any hair follicles. And with an endoscope, we go in, we release all the attachments, and then we thinned out these frown line muscles, so it's like getting permanent Botox. You'll still be able to raise your brow.
Yeah, I can
You'll
do
still
that.
be able to frown, but this will be gone.
Yeah.
And then we keep it. Now people say, how do you keep that in position without cutting any hair or cutting any skin or moving back your hairline? Well, we use a device called an endotine. The analogy is a carpet tack. It looks like a little device, a triangular device with little prongs, and then we place it onto the skull, and we pull back the skin at the position we want it, and we just kind of like press it onto the prongs.
The muscle too? Or
No, there's no muscle up here.
Okay.
So just the skin. We pull it up,
Okay.
press it onto the prongs, and then we stitch it up closed. And then within 3 weeks, the brow will stick in that new position.
Oh wow.
And it lasts. I've seen brow lifts I've done 17 years ago with this technique, and they're still available.
You know, that was the most amazing thing because I get my makeup done for the show at Ivy and Lee's Beauty Lounge. And they were just amazed at my eyelids. And they asked me if you had done my upper eyelids, but you didn't. It was just from that brow
Right.
lift.
Right.
Amazing. It really looked, now I have much more space here on my upper
It just
lids.
popped. Your eyes
Yeah.
just popped. And
And you also did a little something in the corner of my eyes,
we
right?
raised up the lateral corner of your eyelids to give it a more youthful look, because a youthful eyelid is one that touches the pupil on the bottom. And we're talking about subtle changes. One of the things, if you know, some people have had their eyes done, you get a little bit of this round-eyed look, and it's so common it wasn't even considered a complication. But there are ways of preventing that. And you didn't really have any fat pockets or anything that. You had a little bit of loose skin, and that's where the laser came in. We lasered. And then when we did the fat grafting, we restored all the volume to your face that was missing. And now you have your youthful volume. And a lot of women, well, men also, but mostly women, it's very evident this area, the jawline area, starts to deflate.
Yes.
And that's why it's crucial to put some fat. Once you build this area
so
up,
you put fat all along the jawline here?
the jawline.
I like that. I love having a jawline. Oh, because
We balanced your
it
lips.
was deflating, yeah.
We balanced your lips. We put some in the upper lips to balance. You had a fuller lower lip, so we balanced your upper lip. And then we did. We put fat in the cheekbones and the temporal region. We also put it.
And you
in
took
the
this fat
tear
from
trough.
my abdomen.
We took it from the
Gave
tummy.
me a nice little mini
and
tummy
now
tuck
the
here.
bonus is you have a perfectly flat tummy.
I
so,
do.
so that's
For the first time ever.
it's a win-win.
Yeah, that was.
It's a win-win, and I love fat because it's your own tissue.
Right.
It's got stem cells. I can use as much as I need without worrying about paying for syringes, which is something that the patient has to be aware of. I tell patients 5 syringes of a filler is only 1 teaspoon.
Wow.
So we inject you with the appropriate amount of fat, and I don't overcorrect too much.
So how do you take the fat out? Do you have to handle it
We
in a
take it
specific
with
way?
hand suction kit with a syringe and a special cannula. I don't like to use a machine because the suction of the machine is too strong and it may damage the fat
And destroy
cells.
it, right?
So we take it out and then we process it in a special way. We rinse out the oils. We separate it from the extra fluids, and then we inject it immediately. We don't let it sit around. So that's usually the last thing I do. That's the
Okay.
the last part of the surgery. And this way, it's also because I've
Then
done
you
all the
know where to
surgical
put it,
part.
right.
We know how much and where to put, and we can actually balance out natural asymmetries that patients have, because nobody's ever symmetrical on two sides of their face. So we can actually cheat a little bit and make it a little bit more symmetrical.
And fix it.
And then the last part was the laser, which I hated doing, and I tell most of my patients, to me, I hate doing it. It's a necessary evil.
Yeah.
And you were not bad at all. And the only reason why we
felt
did
like-
it was
Oh, you
just
mean- okay.
the laser. The only reason why we did the laser is because you had some hyperpigmentation.
And that has always bothered
has
me.
always been a problem
And I'm
for
always
you.
trying to get rid of those brown spots on my face, so we took care of that.
And we tightened up the eyes. So I figured, you know what, you're already out, and once you need to get a good laser procedure, you need to be out under anesthesia.
Yeah, they do them a lot in spas and things like that, but that's different, right?
There's no way that you can effectively do a good laser treatment. It depends on how severe the problem is. There are certain treatments you could do for spots, like an IPL
Right.
treatment. You could do that. That works great. But this also takes care of the wrinkles, and even chemical peels of lesser magnitude like TCA will not get rid of wrinkles. They make them a little smoother, and they do get rid of pigment issues. But to me, there's nothing like a laser because it's worth
Yeah, that's what he told me. He said,
downtime.
if you really want to do this right, do the laser.
Right.
Because it gives you all new skin, right?
Well, you're going to see a year from now. You don't see the final effects for a year because just with the fat cells alone, the stem cells will rejuvenate your skin from the inside out. And on top of that, the thermal damage from the laser will actually make your skin look more youthful. If you took a biopsy of your skin before the surgery, and a year from now you'll see, look, the collagen fibers will be more organized. It's more youthful skin. And,
Wow, see, now that's worth it.
Oh yeah, it's great, and most of my patients wind up getting some laser because they live down here,
Right.
and it's not a sign of aging either, because there are 90-year-old women who live up north who have the most beautiful, flawless skin. But when you live down here, the radiation is so damaging. Even if you just walk to your car back and forth, or your daily activities,
Right,
even
it's
with
hard to avoid it.
sunscreen and everything, that helps. But it doesn't permanently prevent anything from progressing.
Right. Now, I'm still pretty swollen, and I guess a lot of that swelling was because of the laser, or was it a combination of everything?
It's a combination of everything, but the laser does give you a little bit more downtime. And what I usually tell my patients is, the first week you should feel okay getting out of the house, but with the laser, it takes about a week to 10 days.
I wanted to get out of the house, but
Yeah,
I
a week
was
to 10
scared
days
anyway.
before you've healed from the initial peeling, and you're ready to put makeup on. We don't want to put makeup on too early.
Right.
And then by 2 weeks, you look pretty good. Like you're at 2
I'm
weeks today.
still pretty red.
Oh,
But,
yeah.
but this is all covered up. Ivy
Yeah.
and Lisa at Ivy Lee's Lux Makeup Lounge did a great job with
She
me.
did a
They
beautiful
did several
job.
layers of colors to get the right.
She did a
right
beautiful
look.
job, and
Yeah.
I wish everyone had that access to them. Maybe they can look
We're
her
going to
up.
give your patients access to them
Because
because then when you get to this point, you want to go out, you feel fine. You're very, very red.
And in one more week. So usually I tell them, for the average patient, by 3 weeks, that's when you can go out comfortably socially. And everyone's different. You have very sensitive skin.
Yeah.
But everyone's a little different. And but by 3 weeks, most patients with makeup, they look pretty good. But then every week after that, by
Better and
6
better.
weeks, you're going to look fantastic.
Yeah.
By 6, and then even if you think that you're already happy, even I'll be happy, and I'll see you a few months later, a few weeks later, and I'll see the progression because I don't see you every day.
Mm-hmm.
And you'll see by the end of 6 months to a year, you'll see some major changes.
Yeah.
Subtle, along the way, but if you look at your befores and afters, that's when you'll see they just get better and better.
Yeah, the laser, now that I'm past it, I'm really glad I did it. But that was really the only uncomfortable part. And
Right.
it's so funny, one night I started to get hungry again. I got my appetite back after a few nights, and I wanted French food.
Oh my God.
But my husband's working. Like, there's no way I could go out and get it. So I decided I was going to order it from delivery dudes. You know, they have your. But the problem is going to the door and opening the door. I would I would really terrify somebody. And I was like, you can't really wear a ski mask to open the door. So I was trying to figure this out. So I looked on the computer to see exactly how much I owed them. I calculated my tip. I got cash, instead.
You left it out in the door.
No, because I thought if there's a credit card, we're going to have a conversation, hand things back and forth. So I turned off the light in my foyer, and I turned off the light on the front porch. So the poor kid had to come up in total darkness. And then, he rang the doorbell, and I just opened the door, and pitch dark. I just said, I'm sorry, I just got back from a trip. My light bulbs in the foyer and on the front porch are burned out. Here's the money. I counted it out. Give me the food, and I shut the door. I got my French food, but that was desperate.
Well, nothing stops you from getting what you want. That's good. That's good. That's
but
good.
Really, it had to be dark.
I have to admit, you were a great patient. Nothing really bothered you.
Yeah, well, I was into this. I thought I want to share it with other women because, that's what I do.
I have some patients that actually get depressed the first. I'll be honest with you, the first couple of weeks they'll get depressed.
I read about that,
especially when we do all this with the laser. It's very disconcerting.
I know people that have done these procedures and gotten depressed. That didn't happen to me, but it depends on the person, or
I think it depends on the person, and I think because you were so educated about it before, and you've probably seen a lot of work too.
Yeah, I'm always filming this stuff, and usually I use models, other people, other women in the community, or friends of mine. But I thought for this one, I really can't put somebody else out there and say that they're going to get facelift, they're going to get cosmetic surgery, show their befores. Show them when they're really, because I'm doing a whole film about this. I'm going to go step by step by step, everything but the actual surgery itself. And I thought, it can only be me because I don't want to have to worry that, if I show that one, she's going to get upset and that's too bad. But, since it's me, I don't care. So I can show everything. So I was excited about that aspect of doing the whole thing, because I would wish that I knew somebody that did this, put it out there and had a video I can watch and learn everything. So maybe that's why I didn't get depressed. I was like, very excited.
Well, because you're in tune with them. Until it happens to you, it's, you could be pretty shocked when they look at them. So it's the surgery is not bad at all.
No.
It's the laser. Once you do the laser.
The patients I saw in your office that had just had surgery in the last couple of days that didn't do laser,
no,
they looked fine. They looked good.
They look like they can go out even the next day or so. I mean, with makeup, I told them, listen, if you feel like going to a movie, go to a movie.
Right.
It's.
Really, I thought about going to iPic when I was really bad, but then I thought, I would have to wear like a hoodie to get into.
They call the paramedics.
So I really didn't leave my house for 5 days, but after that I was out. I started going to drive-thrus and scaring the people in the window in drive-thrus.
Well, but I was sure you were texting me pictures over the weekend.
Yeah.
Last week it was only a week.
Oh, I did sneak a little makeup on before I was supposed to.
I think it was a Thursday night. You were going out on Friday night.
Friday Romano, or maybe it was Saturday.
And you looked so good. I was shocked how good you looked. The way you put the makeup on.
Yeah, I was like, really, no way am I missing a meal at Trattoria Romano. So I was like, I'm going to do this. So I tried to just put the makeup on away from the sutures. I still had sutures going out with like threads. But it's dark in there.
Right.
So I bought fresh makeup thinking, okay, that'll be cleaner. And I just put it on to the point where it was fine.
God bless you. That was great. No, it's good. It's good to have that attitude because it makes it easier.
Yeah.
But usually people, once the skin starts coming back to normal, by the second, third week, then they feel really good. And then they come in at that third week and they go, I'm so happy. I was a little scared of being, but then.
Well, also, most people don't want other people to know. So, like, if you went out and if somebody said to me, what happened? I would tell them exactly what happened.
Right.
But other people would be like,
To tell you the truth, I'm surprised being around here for 26 years. Most patients, it's so accepted here in South Florida.
It's almost a status symbol.
It's not a big deal. It's almost like
I know, and I'm trying to change
it's like going to the
negative
dentist or getting dental work done. I mean, it's nothing
You're
to
right,
be.
because I have friends in other cities like Tampa, and they were kind of appalled when I told them I was doing this. It's not as normal in other places.
Well, they're most the West Coast people are mostly Midwesterners.
Yeah.
So a little bit more private about that, but not that much anymore. I mean, I've seen a change in them because we do get people from that area, from the Midwest, and from up north. But the attitudes are changing. That this is an accepted thing, and people are living longer.
It really is, especially around here.
Lives, and
you can go to the gym, you can work out, you can do all that, but your face gravity just takes a toll. So why not fix it? I really don't see what the
The,
I guess there's a stigma. Some people feel that there's a stigma that you shouldn't do it, but I don't see why.
not around here.
I know Boca's different.
It's. I think most people in South Florida, it's not such a big deal. California, and wherever there's, even South America. I mean, this is
Right,
not a
sure.
big deal at all. I mean, patients really, and when they see the results and how youthful they feel, and the other thing, people here, the first question people ask me after surgery is, when can I go back to the gym? When can I exercise?
Oh yeah, when can I go back to the gym? I've already been.
Well, I mean, you could take it easy.
No,
The big thing I
haven't
just
gone back
want
to
you
my
to.
regular gym, which is a really hard gym with a lot of jumping and up
Right.
and down and stuff. But I've been taking long walks and working out in my little home gym, stuff like that.
Well,
But-
see, that's the thing. I mean, you're so astute about your diet and working out and everything. There's only certain things that can do, and then when you look in the mirror and you see that you got your face from 20 years ago, I mean, that just boosts you, as far as your morale is concerned, even your health. I think people who get cosmetic surgery live longer, happier, and healthier lives. And I'm not just saying
Yeah.
that. As there's actually been studies about that, and
Mm-hmm.
because it just changed your whole frame of mind, you're more apt to look out for your health and eat healthy and exercise and stay away from.
Right. And Boca Raton's all about that. Everybody's like very active. In fact, I was in the beauty lounge today, and Ivy, one of the makeup artists, said that Boca Raton is everybody's kind of ageless. Everybody kind of blends in because they're doing procedures, they're out at the gym, they're very conscious of their health. So it's really kind of
They eat well, they exercise. I mean, it's so different here. It's so different, and California also. Wherever you're in a sun-exposed area and you're on the beach, it's just a whole different attitude. You're not bundled up in sweaters all year long.
hiding. Yeah,
But
you're out there.
But it's a pleasure to do these operations because the biggest kick I get is seeing somebody post-operatively and seeing
Yeah.
how they turn out. And
Sure.
it's fun. It really is. I really enjoy it.
Yeah. Oh, I would imagine it would be a fun profession because you're
It's-
really. I mean, you can turn back the clock on somebody. That's
Oh yeah,
that's incredible.
yeah. It really is. I mean, and it can be done. It's just you just have to understand the anatomy and with all the
Yeah, but you
tools
got to
we
go
have.
to a good doctor, people, because we've all seen the examples of other doctors. So that's why I picked you. You got to really, really choose your doctor well. Okay, I think we got to go to break here for a minute.
Okay.
And we'll be right back. Serendipity Consignment Boutique is unlike any other consignment shop you have ever seen. Lisa has the most beautiful and immaculate designer bags, clothes, shoes, and accessories. It's a designer candy store. Ivy Lee's Luxe Makeup and Beauty Lounge in downtown Boca Raton does fabulous professional makeup application. Make an appointment today and see how glamorous you can look. Call 561-409-4065 to book your appointment. Welcome back to the show. Before I go any further, I want to give a shout out to Tony. Tony was my anesthesiologist. Great guy. He's a really cool guy. I remember right before we went into the OR, he said, pick any song you want. Because what did he have? He had that thing where he can pull up any music.
Oh, the Google thing.
Yeah, some new thing where you can. And he goes, any song, name anything. So I was trying to think of the name of this song that I used to love, and I couldn't come up with it. So then I said, I don't know, maybe some Eric Clapton. So then he comes back and goes, which one? I go, I don't know. Pick one.
Oh, I love him. He's great.
So I was like, okay, Wonderful Tonight. And I remember right when we went in the OR, he starts playing Wonderful Tonight. One of your nurses comes in, she's singing and dancing. And I was look up, and that was it. But he's a cool guy. Very good.
I've been with him for several years, and he's a very smart, educated guy. He
Yes, I know
has many
that.
degrees in dentistry and anesthesia, and he's not only is an excellent anesthesiologist, he's very compassionate, and he put my own family members to sleep. So
He was
that's
great.
how much I trust him. So
Yeah.
he's the best, and we actually enjoy being together in the operating room.
Well, you're in there a long time.
We almost don't want to come out. We have such a good time in there, and creating these results that it's just a pleasure to be in surgery. And he's excellent, and as you can see, you wake up real quick, no nausea.
We got to put this a little closer to you.
You don't have any nausea,
that's fine.
and you feel wonderful, and So it's an art. Anesthesia is an art.
Oh, it is, and it's a very important part of the whole
Right.
procedure.
I mean, a lot of people, you can be put to sleep by thousands of people, and you'll come out safe and alive.
Now, you use general anesthesia. Do you use it for all your procedures?
No,
It
we've
just depends
done
on what you're doing.
some of these. I do some facelifts strictly under local anesthesia.
Wow.
With just a couple of pills and sedatives, and it depends on the patient. It depends what you're doing.
you're doing.
But for something like what we did on you, you want to be asleep because of the multiple procedures. Plus, you're going to get antsy being on the table, and then when we do the endoscopic
Oh, so you
brow
mean
lift-
they'd be awake during the whole thing?
well, you don't.
Not
when
really,
you
okay.
give oral sedation with local anesthesia, you'll still be moving around. You won't feel anything, but it's like going to the dentist. You know that your tooth is numb, but you'll still be able to move. You'll feel some dull things, but it's not the pain. It's just you're going to be under for a period of time, and then certain procedures like the laser, you have to be out.
Yeah.
But the anesthesia that he uses, it's called general because you're intubated, but most of what he gives is propofol. Now, so propofol, everyone knows, is a great drug. It's not only is it safe, but it's also an antiemetic, so you don't really get nauseous with it. And then the purpose of the tube is to give you guaranteed airway and oxygen throughout the
Yeah,
procedure.
see, I like that idea. Yeah.
So it's a safe thing. It's very safe. We used to do a lot of facelifts under sedation, IV sedation, but an anesthesiologist will tell you that sometimes you lose, you have to over sedate them, and then they have issues with breathing, and so it's just better sometimes to put it in, to put a tube, and you're guaranteeing the
Right.
oxygen. But he fine tunes it so that you don't really need a heavy dose of anesthesia, because once you have the local in, you don't need that much. So you're pretty much cruising. And as soon as I'm done, he'll tell me, tell me when you're like 15 minutes away from being done. And by the time I'm ready to put the bandages on, the patient starts waking up, and he says, hey, your surgery's done, and it's over, and they wake up pretty quickly.
Yeah, no, he was great. So if you're listening out there, Tony, I know you told me you listen to my show. You were fantastic.
He is.
Now, speaking of bandages, a lot of people are under the impression that you leave with your head all bandaged up.
No.
That's not true.
No,
You go home with nothing.
No, I mean, we'll put a bandage on usually the first evening.
I did
because-
stay overnight.
Right.
He has a beautiful facility. I had a private nurse and stayed overnight there.
Yeah, you had a fantastic nurse, and
And she washed my hair in the morning.
washed your hair,
Nobody
blow
does
dried.
that. You have the shampoo bowl like in a salon
Yeah.
at your place.
Yeah, well, that's
That's Boca service.
it's probably you don't want to
Right, you
walk
got
out
the
with all
iodine
that
and
stuff
stuff,
on your
yeah.
hair. Yeah,
Right.
but yeah, we keep you overnight because we want to monitor you, make sure that you don't go home and your blood pressure spikes for some reason. You have all these medications in you, and one of the things that we worry about with facelifts is that it could rarely happen. But if you're not in a controlled environment, let's say you go home and you start bleeding, it's called a hematoma. Drains don't stop that from becoming a
happening.
problem. Drains just take out the extra fluid so you don't get that much bruising. The
Okay.
hematoma, if it expands to a certain point, you might not even know it if you have bandages, and you get interruption of the circulation of your skin, and you can wind up with a major cosmetic problem.
Oh.
And you're coming in for a cosmetic surgery, you don't want to have scarring. So
Right.
we like to monitor you, and then we put a bandage on just for the first evening, and we take it off in the morning.
Yeah.
And unless somebody has some kind of bleeding issues that we're nervous about, we might send them home one more day with a bandage. But usually, you go home that day without a bandage.
So I imagine if you didn't get the laser and you didn't have a bandage, you could almost go out places.
Oh yeah,
Yeah.
You could. I mean,
I had to hide, but
yeah. I mean, there are ways of doing a facelift so you don't get that much swelling and bruising. But like I said, when you do the laser, you add that to the mix. It's a little bit more destructive, but at the end, it's worth it. It's worth the downtime.
now I like the fact that you restore people's faces to their original look. So you're not trying to change anything. Because the one thing when I told a few people, I was going to tell people before I did this that I was doing it. I was going to say it on social media. But then I quickly learned that, people get all freaked out. They start texting me pictures of the Joker, things like that. They get all scared because they only notice the bad work around town. So I'm trying to, change that whole mindset.
Yeah, well, I mean, there's always a limit to everything. That's why you have to study the actual natural anatomy of a patient. And it's nice to have full lips, but you don't want them overdone.
Right. And a lot of people ask for that.
Right, and it's not, and it looks really bad when the hairline is distorted.
Yeah, explain that a little bit too, because you don't do any. I know in a lot of cosmetic surgeries, there are doctors that just work on restoring hair from cosmetic surgeries. So how
Correct.
do you avoid that
Well,
problem?
I never make the incision behind the sideburn.
Oh yeah, let's tell them where my incisions were.
It
So
went underneath the sideburn, underneath your
Right
neck.
here?
And you have a naturally high sideburn. So some women, their sideburn comes down really low,
yeah,
but yours is naturally high. So even if you move that back a couple of millimeters, it would show. So we always go under the sideburn and blend it into the hairline. So you're not removing any hair, and you're following the natural lines of the cheek, and then we pull back the skin that way. But if you pull back the sideburn, you'll see a lot of patients who had pretty decent facelifts, but when you pull back their hair, it just looks off because
Yeah,
their
I've seen that.
sideburns back
I've
here. And the
seen
only way
that.
you could fix that is with a hair transplant.
yeah.
But you want to avoid that. So it doesn't actually matter how many facelifts you get. If you keep on making the incision in the right spot, you can have more than one.
Because you put some sutures inside the ear.
Everything, well, depending on what shape of ear cartilage you have, most of the time we go inside the ear, behind the ear cartilage.
Okay.
So this way you don't see
Yeah, I mean, even
any
the
lines
next
in front
day
of the
looking
ear.
in the mirror, I had a very hard time. Your sutures were buried, the ones in the face.
They're called intracuticular
the-
sutures. That means it's all underneath the skin.
Yeah,
So there's nothing on the outside.
stitches on the
No,
outside
because
skin.
if you leave those stitches on the outside, they interrupt the circulation, and sometimes you get hatch marks from it.
Mm-hmm.
And also, there are little breaks in the skin where bacteria can get in. This way, it's totally sealed, and it just heals quicker.
Yeah, there was just like a little knot up here and maybe one down here. Was that what it
Right.
was? And then you just pull it out
And we just
after-
pull them in. We can leave them in as long as we want.
because
So
they're behind the skin.
Right, they're underneath the skin, so we're not in a rush to take them out. So I usually leave them in about 10 days. That way I know your skin is completely healed. And then we can snip them, pull them out, and then after that, you're just on autopilot.
Yeah.
And so it's those little details,
That makes a big difference, though, because I've seen people that you can actually see right along here where they were sutured.
Yeah, and especially if you have a little bit of a tan skin,
You get
if you make the incision on front of the ear, even if it heals perfectly, you'll see a little line where it's hypopigmented because of the incision. So it's not even really a scar; it's a little hypopigmentation. So if you look close, you could see a line going down there. So it's those little details that you try to avoid, and it takes a little extra time. But once you do that, it's
worth it.
It's the difference between.
And then I had a couple of sutures up here, right? From
Yeah, that we used all dissolving stitches.
the dissolve, yeah.
So they all dissolve.
Okay.
And within those endotines that we placed up there, you still
Yeah.
feel them, right?
Yeah, I can feel.
You feel little lumps.
One, yeah.
Yeah, you'll feel them for about 3 to 4 months. These are
Then what
called
happens to
ultratines. They're supposed to dissolve faster.
Oh, they dissolve too?
They dissolve completely. So in about 2 to 3 months, you could start mashing it down with your thumb, and it'll break it up. It's made basically out of the same suture material that we use
She's
for
calling
dissolving
wait,
stitches.
Siggy's calling me, but she's calling my cell phone. Wait. I've been texting Siggy Flicker because she's supposed to call in, but she called. The number went here. Hang on a second. Siggy loves Dr. Handel, so she wants to call us, but she's in
I
an
love
event
her.
right now in
We go back a long
New
ways.
Jersey. So,
I'm so proud of her. She's doing so well.
oh, she was just signed for the new Housewives episode, for the new
heard.
season. Hang on, I'm
Such
just
a
gonna-
personality.
She really is. So hopefully she's going to call us in a second here. But she's got to call the station, not my phone, or we can't put it over the thing. Okay. I'll text her again. We'll see if she calls back.
Okay.
Okay. But anyway, back to the sutures. That was something that really surprised me because I thought I was going to be able to, that's how I was able to go out to dinner when I still had my sutures
Right.
because you cannot see them.
Oh,
That was,
you're probably the best patient I ever had because you're totally not self-conscious about anything.
I don't care.
So that's great. I wish everyone was like you. But no, you're a real trooper.
Well, I had fun. But
the whole experience was fun.
yeah. So let's go step by step. So down here, what you did was
We tightened up the muscles.
you went in through here. Is that right?
Well,
Oh, in here too, right?
the first decision we make is on the neck.
Right.
And then we elevate all the skin from on your whole lower neck.
And you saw the turkey gobblers there
Right.
on the.
And then we identified the two edges of the muscle, and then I stitched them together.
Oh.
And then after that, we raise the cheek skin, and then we find the cheek muscles, and we elevate the cheek muscles and stitch them back up on top of
Okay.
your cheekbone.
Okay.
So that defines the jawline, the cheekbone, and it gets rid of the jowling, and it softens the nasolabial folds. And then that's basically what patients do when they do this. So
Yeah.
and then
I would look better if I.
well, we were putting everything back together again. So I noticed you had these two glands. That
Yes, I had all things hanging down here.
So I actually had to
What
put
were
it.
those?
They're just glands. So what we did is we put a stitch. I put a suspension suture there to pop it in.
Okay.
It's an operation that you can remove them, but it's very extensive and causes bleeding and possible nerve damage.
Keep my glands.
So yours weren't that bad. So just to make it better, we suspended it. We pushed it back in.
Yeah. Okay.
And tightened the muscles
And
around
I
it.
always had no more, but I always had these little things here that look like cotton balls. What would that be?
That's just the jowling.
Just
and
your jowls.
I tell patients, you're not growing fat here. They think that you're just growing fat, and they'll think that liposuction is the answer to
Take it
that.
out.
That's the wrong answer. What happens, you're not growing fat. It's just that that whole complex fell down. It just needs to go up.
Mm-hmm.
And when you do that, if you want to see what you look like with a facelift, what you should do is when you smile, that's why patients look better when they smile, because
smile.
you're pushing everything back where it belongs. You see the fat back on top of the cheekbone.
Right.
So we're just reestablishing that with surgery.
So how long does all this last when you secure the muscles and everything?
Well, there's several factors. Number one is the way the surgery was done. Number two is genetics. Number three is how you take care of your skin. There's maintenance to it, and I think the best maintenance is Retin-A. The next thing you do
I've been hearing about that.
is weight fluctuations are bad. Excessive sun exposure is not good. Now, you live in Florida. I'm not going to stop you from going out in the sun, but if you take care of your skin, you use sunscreen and Retin-A.
Oh, believe me, my friends tease me. I get all covered up when I
Yeah,
go out in the sun.
that won't be a problem. I mean, your skin wasn't that bad at all. And you're a very outdoors boating type person. So,
Mm-hmm.
but and then the other thing is weight fluctuations is bad. Smoking is bad. But I always tell patients the results are permanent. Now, 10, 15 years from now, you're not going to look exactly the same, but the effects will still be there. You'll always look ahead of the game.
Right, and at that point you can
And
tweak
at that
whatever you need.
point, I'm at this point in my career now where I'm starting to see patients
That you
I
had
did
before.
15 years ago or more, and now we're doing them. We're doing like touch-ups on them. We're doing a secondary facelift, and I don't really have to go that aggressive. I don't even have
I
to
was
put them
going to ask
asleep.
you, what do you do for somebody that
Those are the
is-
ones that I can do under local anesthesia
Okay.
quite often. So, but basically, if the muscle work is done and it hasn't deteriorated too much, and they've taken good care of themselves, it's basically just a skin operation at that point. And you might tweak the muscle lift a little bit. There are
Yeah.
ways of just tweaking it without doing an aggressive lift. But every patient is unique. Every patient is different. But you'll always be ahead of the game. And I this past week I did someone's secondary facelift. She's 70 now. I did her surgery 15 years ago, and I did it under local anesthesia. She got a fantastic result.
Oh, wow.
And it's only a week now, and she looks great. I mean, no laser or anything, but she looks great.
That's fantastic.
So a little bit of, it's maintenance, but the effects are always going to be there.
Now, what about with the laser? Do I have to do that again?
Hopefully not.
Yeah.
But no, it's like I said, you weren't bad to begin with. Mm-hmm. But if you take good care of your skin, you're probably not going to need it again. There might be some small areas you may want to tweak under little local anesthesia, but not necessarily. It's basically, Retin-A is a great product.
Okay, so if you use Retin-A, you use it daily?
Well, there are different strengths, and there are different Retin-A products. I mean, they're mixed with other ingredients. The key thing, there are many companies that put out products, medical-grade products, and we've been through all of them, but every company has a little twist on what they do, but the major ingredient is Retin-A. What Retin-A does, it it peels the skin, so you always get that. And then patients will say, it irritates me, it peels my skin. Well,
That's the idea.
That's what it works.
Yeah.
So depending on and then it also restores the collagen fibers and actually makes your skin more youthful. It can actually get rid of precancerous cells, especially for a fair-skinned patient who lives in the.
Oh, so if they're starting to develop skin cancer, you're basically
Well, the
sloughing it
actinic
off.
keratosis, which is pre-cancerous, it'll help get rid of that. And by the way, the laser probably puts you way ahead on that. And but anyway, with the Retin-A, it's just a good maintenance thing. And then there are different strengths. So depending on your skin, we'll prescribe a certain regimen for you, and then you might want to start out with a weaker dose, and then maybe elevate it to a stronger one, and then maybe do it once or twice a week. Or some people do it every day. I think that's a little too much.
Are you peeling the whole time you're using it?
No, it's minuscule. That's
Okay.
why you might, after you get your skin to a certain level, you cut it back to a smaller concentration and then maybe do it only a couple times a week. But I've seen patients who use Retin-A for years and years. Maybe they even overuse it, but they've got unbelievable skin.
You hear that, people? Because I've heard that lately. The people that the girls at the beauty lounge love it.
Yeah.
And
No, it's a great medication. It's a great.
do you have to get a prescription, or is it
You
over the
have to
counter?
get a prescription.
Okay.
They have some over-the-counter retinol products.
That wouldn't be the same, right?
Well, the problem is they can't sell anything with a high concentration to the public at the over-the-counter because they'd probably be deluged with phone calls because of irritation and skin problems.
Oh,
So,
yeah.
you need, when you have a medical grade product, you need to have a plastic surgeon or a dermatologist or someone to follow you, or a good
Make sure you're close
esthetician,
enough for this.
or a good esthetician, so that they'll be able to
Yes,
monitor
I
you.
got before I even did this, I went to your office and saw your esthetician for a what did she do on me? Some kind of a dermabrasion?
Microdermabrasion.
Wow, that was really nice.
Right.
Yeah.
There's so many things that you can do. I mean, that's kind of a maintenance thing. It works great for people who have nice skin and they have some pigmentation issues, or you just want to maintain the skin, and you use that in combination with products. Once you treat it with the microdermabrasion, the products are able to penetrate the skin better. So you get really good results with that. But there's certain levels of skin issues. Once you get to a certain degree where you have heavy wrinkles and deep pigmentation, then you need laser or intense pulse light or even a deep chemical peel. But we don't do those phenol peels anymore.
No, the chemical peels?
No, well, we do TCA peels for pigmentation issues or for minor issues. And there's my esthetician, Nicole, does what they call VI peels. It's for the working woman or someone who's active and they don't want an aggressive peel.
Yeah.
So what they do is you space it out every couple of weeks, 2-3 weeks, and then the downtime is not that bad. You do get a little peeling. It is effective. And then by the third, if you need the 3 sessions, by the time you get to the third session, I mean, your skin looks pretty good, and it gets rid of a lot of those hyperpigmentation issues, which plagues a lot of women because of either it's hormonal issues from birth control pills or just childbirth, the melasma.
Yeah.
So those could be very difficult things to control.
Right.
And it does help with a lot of patients. So the microdermabrasion, and there's a lot of other ancillary things you could do, but at a certain level, you need something.
Now, if somebody
strong.
does a facelift but doesn't want to do laser or anything, can you get rid of the wrinkles just by pulling
It depends on the depth.
Okay.
It depends on the depth. Just using Retin-A alone for 6 months
Would do it?
does make a noticeable difference,
Oh.
but not to the point where it's going to remove a deep wrinkle. And doing chemical peels. Let's say there's a peel called a phenol peel, which was very popular in the past. I did a fellowship with one of the plastic surgeons who was the world's most renowned person for phenol peels. And when I started doing my fellowship with him, I only saw him do a couple of them because he switched to the laser. The phenol peel is an unbelievable peel. It works great. It tightens skin. It gets rid of every wrinkle. The only problem is it does get rid of a lot of the pigmentation. And that's why I used to see these patients with kind of a white mask-looking face.
Oh.
And you'll see the line of demarcation here
Yeah.
where it stopped. But there are modifications to a phenol peel, and some surgeons and dermatologists still use it.
Use that one,
and it's
okay.
pretty good. It's just that you have to adjust it for each patient.
Right.
But with the fractional laser, we get great results. And
That's what you used on me, right?
That's what we use
it's
on
a
you.
CO2 fractional.
Fractional CO2.
Okay.
So what that does is the fractional mode.
I could see the little like square grid marks.
The little
so
dots.
It's like, yeah.
Right. And what that does, it leaves fractionalization means it leaves little microscopic dots of epithelium that allow the skin to heal and regenerate.
So you're not actually burning off all of the skin, right?
No.
You're leaving little columns of skin in there?
Exactly. Little islands of skin that regenerate. And and then for each part of your face, we use a different setting. Mm-hmm. So this way we blend it in onto the neck. And the neck, you can't use a very high setting. Mm-hmm. Around the mouth and the forehead where the skin is thick, you could use a higher setting. Mm-hmm. And then when you elevate skin with a facelift, you have to be careful. You can't go too deep. So we back off and we do it a very light. We blend it in towards the outer edges. Yeah.
Okay.
So I love this laser because I can safely do that.
Yeah.
And it's just the results are.
Well, I can already see how clear and smooth my skin is. So that's that's very thrilling for me.
Right.
It was worth it.
Yeah, I mean, there are a lot of issues you have to, deal with, and you could worry about hyperpigmentation after laser. That's why we treated you with bleaching cream almost immediately to prevent that. Mm-hmm, mm-hmm. So,
while we still have a little bit of time left here, I want to say that we're going to do a little event. I was talking to you about it yesterday. I'm not quite sure the date yet, but it'll be sometime within the next couple of weeks, where Dr. Handel and I are going to be out at a local business here, and you can come and meet him and check out my incisions. You can look through my hair. You can look up behind my ears. You can look up close at his work, because I don't care. I mean, if you're really curious, people never show you this stuff, but I will let you dig around on my face and my hair and look everywhere and see exactly what this entails. And you can ask him any questions you want, because, I would have liked to have had someone do that for me before I did this so that I would know exactly what to expect. And Dr. Handel, give us your information of your, it's the Handel Plastic Surgery Center.
Right. We're located 5503 North Federal Highway. We're a fully licensed ambulatory surgical center, 2 operating rooms. And
it's a beautiful facility. Really nice.
Thank you. Thank you.
Really nice.
I'm real proud of it. And it's a great place to do these kind of procedures.
Yeah.
And
I was very
safely.
comfortable there. I felt one, and you have wonderful staff too.
Oh, thank you. Oh, yeah,
they're
genuine. They really mean it.
Okay, all right, we gotta go. So it's Dr. Handel. He did my cosmetic face work, and I love him. Great guy. Thanks for tuning in, and we'll see you next Thursday night. You have been watching and listening to The Becky and Boca Show. Tune in every Thursday night at 6 p.m. to discover all the ways to spoil yourself and have a good time in beautiful Boca Raton. See you next week.